بسم الله الرحمن الرحيم. السلام عليكم جميعا ورحمة الله تعالى وبركاته. أحاول المحاضرة حتكون بالإنجليزي mainly. هطعمها شوية بالعربي لأنه الappraisal and revalidation is based on يعني British experience in how they appraise doctors in practice. How تكون is just to elaborate how does this kind of appraisal happen and why and for whom exactly. To begin with, I would like to share a timeless wisdom from Rasul sallallahu alayhi wa alayhi. Said, حاسبوا أنفسكم قبل أن تحاسبوا وزنوها قبل أن توزنوا وتجهزوا للعرض الأكبر. This in principle almost like what appraisal is about. Exactly. So it's about self-reflection, about auditing ourselves before someone else auditing us, how we are doing. يعني أنت لما تسوي audit at the hospital institution you work with, they audit your performance, that they're evaluating you. But the appraisal, it's not the case. It's about mainly appraising yourself, finding out how much you need to improve. Are you improving? Are you doing well? What exactly your scope of work, what your need, what your professional need and development. So in principle, حاسبوا أنفسكم is a self-reflection or auditing yourself. And تحاسبوا, that's the appraisal process. And the العرض الأكبر, I would say, it is the revalidation. So appraisal is a yearly concept, happen every year. And after that, after 5 years of appraisal, you will have a revalidation. Revalidation meaning recertification. American call it recertification. That means recertify that you are a licensed doctor. In a specialty, for example, they have to do exams in America. In the UK, it's different. In the UK, we do this appraisal and revalidation. It's really kind of informal. Doesn't have an exam when I say formal, but the meeting is formal, of course. I will go through that, how we do revalidation. And I think Dr. Haider and Al-Hay'a, they would like to acquire this form of appraisal. This is how we do it. It's not about assessing your performance. It's not an exam for doctors. شوف هاي الصورة I always see it in wherever I go للحرم الحسيني العباسي الإمام علي, and I ask myself why it is there and why people doesn't follow the order. What do you think that means? Why this instruction to stop videoing or take picture in the haram? Despite that, you see all the mobiles hanging in the air. Why do you think is the reason? In my own view, when I try to think about it many times, I think it's because people don't know why. If you know why something shouldn't do, you will stop doing it. So explain it to me, I'll stop doing it. What is bad about having such sign not followed is people will used to not follow order. So if I see a sign, don't do, but everybody do it. So there's no meaning for such instruction. I will not follow the law, I will not follow the order. So always good to know why, so I can follow the order. That's why I'm here. I'm going to explain why we're having that appraisal. So don't be afraid that this is a new concept. You will be judged against your performance. You will say, yeah, you're not doing well, etc. It's not about that. It's about helping you to progress, to self-develop. It's all about that. So what is appraisal? I will talk about that. What, why, when, and how, and who should do those appraisal. We'll cover that, inshallah. And the role of and responsibility of everyone in the team of revalidation and the process of appraisal. The team of appraisal consists of these people. Responsible officer, usually like a medical director or a responsible officer, usually in our institution, for example, back in the UK where I worked, we have responsible officer is the medical director. This responsible officer send the recommendation of revalidation to the General Medical Council, GMC. In our case here, it will be the hay'a, the head, to say that this doctor has finished his appraisal or has finished his revalidation. That's what the role of responsible officer. There will be assistant director, medical director, and etc. All these people will be part of the team of the appraisal. You will have appraisal team and manager to book the timing, to look for those paper, manage those paperwork, etc. The purpose, as I said, is mainly about discussing the doctor's need. So you have someone like your friend, you say, I need to help, how I can improve myself. You always go to your close friend or family member, to help you. عليكم السلام ورحمة الله. العفو، تفضل. السلام ورحمة الله. دكتور بدر، تفضل تفضل. So الغرض هو purpose of appraisal is to help and guide. It's not guidance like you guide a trainee, of course, because it's your colleague might be even more senior than myself. But the fresh eye to see someone else or to appraise someone, it's an external environment. You don't see your own self normally. So that's why you need someone else to be your mirror. مرآتي. أنا أشوف أحيانا مو يقول لك الأخ مرآة المؤمن، يعني الأخ مع أخيه يكون أحيانا مرآته، يشوف عيوبه في حتى يعكس how he does whatever is good or bad, so you can improve. That's the mainly. It's not about judging, and you find out if there is any scope of improvement, anything to stop doing or continue doing. So that's what's the principle of the appraisal. And as I said already, not a performance. Let me remove this on the way. Not a performance management, and not a job planning. So there's something called job planning, which integrate with the appraisal as well. Job planning, that means what's your work schedule in a week? What do you do like Monday, Tuesday, Wednesday? What exactly your work schedule? Everyone should have a job plan. What exactly doing? And that's a different from appraisal. It will be integrated. I'll show you that in a minute. And it is not ARCP. ARCP is annual review of competence. This is for trainee. Trainee, they will have competence review each year. That's the annual. So they can progress in their training. Without that, they will not progress. That's ARCP for trainee. It's not in this case. Stopped working. And it's annually, happen annually. As I said, not an ARCP, and it's yours. It's yours, not institution. It's a requirement. It's for you. It's not for where you work. And need to cover all your scope of practice. What you do, you should cover it all in your reflection, in your evidence of performance, etc. And that's all goes into the portfolio. And should be formative. Formative means you'll have a meeting schedule like this one, for example, but one-to-one in office, completely confidential, away from all distraction, and should be really a good time, no interruption, and always, even the appraiser at the end will be assessed how they appraise the appraisee. So the appraiser get also assessed how they did the meeting. Under reflection, always reflection. Any evidence you give without a reflection is of no use. The key in the appraisal is reflection. So, a reflective practice in itself it's a science in itself. There are books written on how to reflect, what kind of piece of information you need to write in my research. If I do research, for example, and after finishing the research, you look at the piece of work you did, what I did well, what I should improve on. There are things that you can reflect on. I think maybe الأصمعي يمكن قال إنه ما كتبت كتابا إلا وقلت بعد ذلك لو غيرت ذلك. يعني في أكو process of reflection always changing. فماكو واحد يعني perfect. Always look for a better position. هذا كلمنا عن designated body. هنا for example أنا أعطيتكم مثلا example. You could do مثلا designated body the whole هيئة, or you could have organizational one and feed back to the head of the department of responsible officer. So each hospital will have a designated body. Each of you work with Khadija, you will have a designated body in Khadija. In Mushtaba, they will have a designated body. And then the designated body, they will go to the responsible officer, which should be in the Hay'a. That's how the structure. I talked about job planning. Now, if you have a job plan, you know what you do. You know what on a daily basis you do. So that's how you're going to you reflect on your performance. And that's where also you can change the job planning after discussing with your appraiser. Let's say, I'll give you example. مثلا أنا عندي رغبة في أني أتعلم new procedure. Okay? بس ما عندي هاي skills. You could bring that up in the appraisal process and talk to your colleague. I want to learn this. راح يقول لك هو what's your challenge? Why you can't learn it? You will go through all that. They will give you brainstorming. So you get someone to talk to and have some brainstorming idea. They give you some hint, some help. They might find somewhere else to help you. المهم راح تلقى في يد المساعدة حتى just to help you, give you that push, to support you. لأن لوحدك أحيانا إحنا نحس يعني أكو فد شيء stopping us from أو إما مستحى أو فد شيء معين أو نشوف نفسنا مثلا أنا consultant ما أقدر أطلب من اللي أقل من عندي مساعدة. هاي كلها تذوب الحواجز هذه في العملية مع البروسيس أوف appraisal. راح تشوفون هنا إذا عندي appraisal meeting راح تشوفون هاي بالتوب appraisal meeting it doesn't ايش اسمه highlight بس appraisal meeting بعدين you agree on objective راح تشوف business planning and service development مال institution اللي تشتغل بيها and then you agree of a service objective. بعدين يصير job planning review based on your appraisal what you want to change. هنا راح تقدر you can even annual pay progression sometime. If my job plan see that I work more than I meant to be راح يصير عندي review يزيدوني مرتب. أنا مثلا أشتغل أنا مثلا راتب إحنا عندنا مثلا 10 PA يسموه program activity. إذا شافني قاعد أشتغل أكثر من 10 راح يقول recommendation هذا قاعد يشتغل عنده بالscope of practice مالته راح يشتغل أكثر من 10 PA راح يصير مثلا 12 PA. 12 PA ما راح راتبه يزيد 20% لأنه قاعد يشتغل extra مايل يقول extra. مرات تشوف لا أقل هو meant to work 10 بس أنت تشوفه بالجوب planning قاعد تشتغل أقل فيصير 80% مثلا. ذاك عندنا مثلا إحنا عندنا part time 60%, 80%, 100% are full time and 120% if you go extra work. ماكو ناس مثلا أعطيك example أنت clinician work in a hospital بس عندك مثلا role in the university عندك lecture بالuniversity هذا extra work بالuniversity إما get paid by the university themselves وهاي external ما لهم علاقة بس إذا عندهم link they should get paid to the hospital وينضاف على الراتب مالتك. فيصير عندك جوب بلان مال 120% على اساس انه تشتغل في مكانين بس one payment. هذا الغرض اللي تكلمت عليه لانه هذا له علاقه بالجوب بلاننج. لما تيجي تقول انا قاعد اشتغل اكسترا راح يشوف انت قاعد تعارض ويا شغلك لو لا، راح يساعدك يقول لك هذا ترى ممكن يكون مرهق لك، وبالذات اذا كان مرهق راح ياثر على البيشنت سيفتي. انا من خلال الابريزل شفنا حالات انه دايركتلي اذا شافك patient safety concern from the appraiser directly يرفعها ل responsible officer، لانه هاي patient safety ما توقف. اذا بالذات اذا لقيتها معقده مثلا واحد يقول له بالابريزل يقول له والله انا ما قاعد اقدر انام واروح للصبح دايخ للدوام. هاي patient concern. اذا شاف ما قدر يغير من شغله او عرف مثلا انه قام يتعاطى مثلا من خلال الهند. اكو حالات صايره يعني. فمجرد ما يصير عندك big concern هاي دايركتلي تروح للريسبونسبل اوفيسر. هاي يتغير مجال الابريزر لازم ترفعها الى هاي ريسبونسبيلتي. هاي طبعا رير اكزامبل، انا احكي لكم يعني الابريزر بروسيس شلون بينيفيشال، شلون مهمه اور براكتس. شنو الرول مالتي انا؟ what do I need as a appraisee؟ يعني انا رايح عندي appraisal، انا لازم I should know who is my designated body and I should check my record of revalidation. هاي my responsibility هناك. اذا راحت علي ممكن يسحبون من عندي license of practice. انا revalidation مالتي راح بصير 2027 باليو كي، لازم اروح اقدم بس كل سنه appraisal كمله والريفاليديشن ب 2027 حتى I carry on holding license to practice. احنا هنا بالعراق نحاول نسويها على الانستتيوشن، مجرد انه شنو مو بهالفورماليتي راح تصير، مو لدرجه انه ممكن يسحب منك license to practice. ما عندنا هاي الفورس او الاثوريتي to do so، بس شنو هذا راح to help and guide to progress in your career, to be a better doctor in your career as well. هاي البروسيس اكو مهمه انه عندك supporting information. راح نقول هي 6 domains بال supporting information you need. شنو ال piece of information you need to provide for the appraiser to conduct the appraisal, and then review your PDP, personal development plan is really important. If you have a plan, you will have a good outcome in terms of learning. Other information you could put, like any achievement. Let's say you publish a case report, you did a research, you did a charity work, anything, any achievement in your work or outside the work, you can put it in the appraisal. Any challenges you have. I had a challenge with my colleague, for example, in the timetable, the work schedule, etc. You can bring it up and they will help you to find a way of dealing with that. Any aspiration, what do you want to do? Like you're looking for to be a professor, and they might help you to become a professor, to become an academic, for example. And then after that, sign off by doctor and appraiser of supporting information. Both of you will sign off the supporting information. And then they meet together, confidential appraisal discussion. They sit together for around an hour to 2 hours. من ساعة إلى ساعتين هذا الميتينج. And after that, you will have a new PDP. So this is the previous PDP, last year. They'll review what you did, what you achieved. And then you'll have a new PDP for the coming year. And a summary of appraisal discussion. The appraiser will put together the summary in a piece of PDF file usually, or you write it down depending on the system you use. And then appraiser statement. We can say they'll say this doctor progressing in terms of his career and finish his appraisal. There's no pass or fail. There's no pass or fail in this process. And post-appraisal, again, you sign off the post-appraisal and the paperwork will go to the responsible officer. So there's input and there's output. That's two parts of the appraisal process. What we need to conduct this, we will need a platform. I'll show you in a moment how the platform looks like. But let me talk about what if you miss appraisal in our institution. You can have a good reason to miss an appraisal or postpone it. In COVID-19, for example, 18 شهر تقريبا, 18 months, my appraisal was delayed, postponed. Or you have a maternity leave, you have sickness, anything, approved sabbatical, for example. I am on a sabbatical leave, I have 1 year off work, so they can postpone it, or I can do it still, it depends. And unexpected any home circumstances or work circumstances, you can discuss that with your designated body, you can postpone it. But there are other reasons that's not really valid reason. Let's say I'm really busy, I can't do that, or my laptop broke down. All sort of excuses might not be accepted by your designated body, to postpone the appraisal or delay it. So it's really important. Part of the appraisal is your colleague feedback, which is called MSF, multi-source feedback, or 360 feedback. Multi-source feedback can be from anyone. Can be from a receptionist. They see how your behavior, how respectful you are, how your time management is, etc. So it can be range from doctors to nurses to physiotherapists, rehabilitation, anybody. They can give a feedback about you. And this only once every 5 years we do it. So it doesn't have to be every year you do multi-source feedback. This is not part of the appraisal process, but part of the revalidation. And usually you can use because this has to be anonymized. You can't give feedback to someone and put your name or your handwriting. You have to be anonymous. So you can give honest feedback. If I know I'll be shy or scared or whatever reason not to say something to someone senior than me, for example. So to remove that bias, always anonymity is important. And the only challenge sometimes, people who cannot have a feedback from a patient, for example, is anesthetist, for example. Anesthetist, they don't have much interaction with the patient during their management, because they are asleep. How to overcome that? The same with the intensive care, for example, is to have the feedback from the carer, or you can have that after the operation. There are some leeway around it. Other things, for example, to do extended peer review feedback, they will have more feedback from colleagues to overcome this challenge of patient feedback. And preparing, I'll show you preparing for the appraisal this is our system we use. This is my CPD. This is my own. Okay, I took a screenshot. This is my CPD. Things what I've done. This is, for example, ISPD. I attended conference 4 days. If you press on that, you'll find a piece of reflection. What did I learn? How that will change? What I'm going to do next after this conference I attended, etc. Click on it, you can see information. All that, they have a CPD point. So this CPD point required each year. CPD is continuous professional development point. In my practice, we require to have 50 a year, 50 point appraisal. So what is 50? What's 1 point? 1 point is 1 hour of learning, continuous. If this conference is 4 hours, this is 4 CPD points. This is generally. There is approval process, of course, for CPD point. So that's my CPD. Next is, for example, you go to the next tab, is my quality. What is my quality? So my quality is what quality improvement project I did, what research, teaching, audit, all of that. So, for example, I did all of these in 1 year. You can put even those GNMDT, that's glomerulonephritis MDT, how I was conducting this, leading this, what I learned, how that changed my personal development scope. And the bottom one, this one is about event. Any event, like critical incident, any mistake, that's when I say mistake, that's what's critical incident about, or error, anything error happened, any complaint, or any compliment. If you have a patient complaint, how did you respond to that complaint? Or a compliment, you can put it as well. Someone send you a letter of thanks, you can put it. All of that, you can put it together. This is, for example, I put SI, this is serious incident for CPE screening. This is, I was involved in this serious incident for CPE. It's not my fault, but I put it there because I was involved as a consultant, missed the screening for CPE, which is the carbapenemase enterococcus. If you know the CPE, we have to do a rectal swab for people who get admitted outside the. This is people who, if you get this infection, even meropenem won't be effective. So that's why how serious it is. We sat with microbiologists, we discussed it, and what I learned, I have to put it there. So that's part of the appraisal. My feedback, these are my feedback. Any feedback I have from trainee, I have email feedback from a colleague, thank me for delivering the teaching, for example. 360 feedback, this is my patient feedback, 360, and colleague. This is I needed to do for my revalidation. As I said, this is for revalidation, not for appraisal. And all of these feedback, anything from teaching delivery. For example, this session, if I have a feedback form, I can upload it to my portfolio to say, I've delivered teaching today. This is the feedback from the audience, and upload it to my portfolio. This one is the PDP. Okay, so this is my objective. The objective is personal development now. What I want to do next, my next year, what I want to do, for example, setting up a center of excellence in medical PD catheter insertion. This was my goal in that year. I was in the process of doing that. I put it there and put how I'm going to achieve that. هذه اللي يسموها personal development plan. This is part of it. هذه الابريزل بروسيس. شوف آخر appraisal I did 2024 2023 2020. هنا الجاب. ليش اكو جاب؟ كان كوفيد، كان في كوفيد صار ديلي. هذا كله ريكوردد. البريباريشن مثل ما قلت انا يمكن راح الوقت يضايقنا. البريباريشن هن هذني 6 دومينز 1 2 3 4 continuous PDP higher CPD continuous professional development, quality improvement activity, audit, quality improvement project, significant event, critical incidents. You have to put anything you involved, or mortality and morbidity meeting, anything like that. Feedback from patient, if where possible, as I said, because anesthetists and other specialty radiologists, for example, won't be able to get feedback because they sit on the front of a screen and give reports. So it would be difficult for them. Only maybe intervention radiologists can do. Review of complement and complaints. That's all I covered already. What is important is always, I stress on that, is reflection. Anything you put, any supportive information you put in your portfolio without reflection won't count, won't be of any use. This is a GMC domains, 4 domains of good medical practice we have to have. And you can see each domain have attributes. Those attributes, so very important to know, for example, I am good in my knowledge, I'm good in communication, I'm good in safety and quality, and I'm good in maintaining trust. People trust me. And in each one, you can see how you achieve that with all these attributes. It gives you really a scope how you should be as a doctor, how you remind you, because we forget always. If we don't remember, or someone remind us how we should do, without appraisal process, you won't achieve that. That's what it is. It's about achieving those 4 domains, this practice. And this is in detail. Okay, I'll show you, I'll send you this link, because they will have the link. You just click on a presentation and you'll find all the information. This is the process of feedback. Now we have Medic at Work. This is the website we use. Appraisal, that's how you follow. Send email to appraiser, appraisal accepted, and then upload documentation, then email to appraiser. They'll review the support information. They will set up a date to sit together, and then they will fill the form, and they will output to responsible officer there. Responsible officer review the appraisal process and send the recommendation to the General Medical Council to say this doctor has finished his revalidation and appraisal each year. So that's the flow diagram of how the process happens. And what happens if you don't do it? That's, of course, important. As I said, ultimately, the worst case scenario, they may put the license on hold. They might stop you from practicing as a doctor. But it's difficult to reach that stage. There will be a reason why someone won't follow the appraisal process. And revalidation team always will be behind you. They will keep sending email. يلحون دائما sending email reminder if you are behind. If you delay more than 6 months, they will notify the responsible officer. In summary, annual appraisal is an obligation back in UK. We looking to make it obligatory in Hay'a. That's what the recommendation. And it's also an opportunity. It's not, if it's something obligatory, it doesn't mean that's not an opportunity. It's opportunity for us to improve, to be a better doctor, because there's no best doctors. Always there is a better position you can be in. The need for revalidation will be set by the Hay'a itself. Providing good evidence and reflection is a key, and completing multi-source feedback for patient can be tricky sometimes, but there is always a leeway around it. هذول قلت لكم اللينكس هذول clickable. هذول إذا لما اديتكم إياها حد بس double click it will open each guidance. It will very helpful guidance about appraisal and revalidation. And these are some useful references. And I should stop there for any question and comments, please. Further.
I know that in the reflection, when we asked about 10% reflection in the hospital about us, I think if there is 4% they are targeting us or have a personal issues, they will take the overall feedback about me, not just that person who are like مستقصدني مثلا. I have an overall picture.
لما بالفيدباك شوف. So بالفيدباك لما تطلب feedback, you have a choice to choose who to give you feedback. Not from everyone. You have a choice to choose people to give feedback about you. I know in a way maybe you'll choose someone who's you're good with and you have no problem with, which is fair enough. You don't want to choose someone who is against you. They will be biased either way. So it's better not to be negative. It's better to be positive. So they give you that. لذلك أنا قلت لكم appraisal is on your side. They don't choose anything. It's against you. On your side. That's why you choose people who give the feedback. But the patient you don't choose. The patient, there's no patient. You can't discriminate. Or this patient, he was happy with me in the consultation. I will send them feedback. لا. بالpatient شو يسوون؟ إحنا السكرتيرة تطبع الأوراق. وباليوم اللي عندك كلينيك بنهايه الكلينيك توزع على كل بيشنت يطلع وانونيموس يدزها بالبريد بعدين يرجع لنا اياها بالبريد بيشنت فيدباك او هو قاعد بالانتظار يكمل الفورم ويعبيها. نحتاج احنا 20 بيشنت يعني لازم كم كلينيك 20 بيشنت فيدباك حتى نكملها. وهذا ما قلت لكم بيشنت فيدباك نحتاجها every 5 years يعني مو كل سنه مو مساله مرهقه يعني مو كل سنه يصير هوايه مرهقه. بس الكومبلمنت every كومبلمنت الكومبلين اذا عندك كومبلين هوايه راح تجي بالنهايه بيشنت فيدباك. اذا عندك كومبلين you have to declare it انه انا عندي كومبلين انا how did I handle that complaint. مو عندنا كومبلين بروسيس لما نجاوب على كومبلين لتر اكو طريقه بالاجابه عليها دائما احنا دائما تعتذر حتى لو انت مو مخطئ. مثلا اكو في الطريقه بالبيشنت patient complain how handling complaint itself بحدها في التوبيك بحدها. نعم تفضل.
There is a scoring system or just present and absent for some things. There is a scoring system points.
لا مو قلت
something not exist and succeed or fail. But there is a scoring system or some things with high points or just present absent.
مو هو انت حطيت سكورينج راح يصير pass or fail.
Present absent.
Appraisal completed or incomplete not complete. Completed or not هو ما بيه مجال. Completed appraisal is fine. إذا عندكم مشاكل outcome of appraisal to be addressed هذا بالpersonal development plan بالكذا يعني هي process to ensure the doctor is on the mend is following improvement following good medical practice. هذه روادها this is all about حتى ما يطلع اكو في patient safety. انا اذا عرفت هذا مثل ما قلت لكم اعرف واحد هذا ما ينام زين صار عنده مشاكل اللي ما يقدر ينام فهذا how he can operate in theatre. I should stop him. He should only do clinic. At least in clinic مثلا ما بي major mistake مثل theatre يعني اكو risk management هنا يصير بالموضوع. تفضل دكتور. عليكم السلام.
What about the online activities like webinars is included in
نعم CPD point هاي هذه continuous professional development CPD point online. إذا حضرت أنت ويبينار 1 hour حضرته بس مو تكتب 1 hour وخلاص راح تعطي ريفلكشن شو تعلمت من الويبينار هذا جس مجرد يعني في النقاط تعلمتها معينة. وأنا أعتقد مو صعبة هسه في وقتنا هذا وجود ال AI والchat GPT. أنت information مالتك you can organize it really well وتعطيها as a piece of reflection. طبعا مو copy paste انت راح تكتب شنو حضرت وشنو الموضوع كان راح يعطيك piece of learning point very organized and very well تحطها as a piece of reflection. تفضل. نعم.
regarding the patient feedback.
نعم.
360 what mean by 360؟
هو 360 اسمها هو السيستم نسميه 360 يعني cover everything. دائرة 360 degree cover everything 360 هذا معناها. يعني ما إلها limit مو مثلا cover مثلا your professional ability مثلا راح cover all your behavior you cover your look your communication everything about you as a doctor. لأنه الدكتور يتعامل وياه مو بس علمه فقط. المرة سألت سويت voting يعني شو اسمه تصويت يقولها ايه if you choose if you want to go to a doctor which one you will choose the most knowledgeable or the most caring. The most caring I choose. Most people say knowledgeable. ليش؟ لأنه knowledge you can acquire it but caring being careful and caring it's something inside you cannot just learn it. Someone is caring he will acquire the knowledge because if I care أروح للبيت أراجع وأشوف أدور خابرة ثاني يوم أقول له تعال لي ارجع لي I'm caring أنا مهتم بالموضوع هاي about caring. فلذلك هنا 360 is important to cover all these aspects مو بس knowledge مثلا فقط. إيه.
Only comments regarding the anesthetic because there is the preoperative assessment clinic and ICU.
نعم
Now,
you can use it.
and the patient feedback.
You can use it. Preoperative is good. If you do preoperative assessment, you can use it because it's a clinic. If it's counter clinic, but sometimes قلت لك أنا anesthetist مثلا هذا اللي emergency anesthetist on the list of emergency. يجون قبل يدخل هذا it doesn't have time to do all the preoperative assessment مثلا. There are مثلا radiologist أما تنية ماكو contact with the patient. شو راح ياخذ patient experience or patient feedback ما يقدر. تفضل دكتور مهدي. تفضل.
أنا سألتك أونلاين لكن أنا أحضر معك أنا دكتورة منى نيورولوجيست سبق والتقينا.
نعم حضرت نعم.
دكتور نحن بالنسبة لنا مثلا أنا سورية دخلت العراق من سنتين وكم شهر. بسنتين وكم شهر أنا ما عندي كونفرنس في العراق ولا مشاركات ولا ايفنت ولا أي شيء. لكن ببلدي ولما كنت عايشة في أوروبا أنا عندي على الأقل 22 سيرتيفيكت لمؤتمرات.
نعم.
هل هذه سقطت مثلا؟
نعم.
ولا نحن نقدر نستفيد من الماضي تبعنا ولا يعني انا مشاركه ومحاضره بمؤتمرات النيورولوجي عندي سيرتيفيكا عندي خبره فهذا كله انتهى بسنه 2021 انا دخلت العراق ب 22 مثلا فكيف بيستفيد الطبيب هو العراقي من خبراته الماضيه في انه يتطور في العراق ويطور ويساعد في التطوير؟
بالابريزل اي شيء قبل السنه هذه يعني عندك ابريزل من مثلا خلينا نقول من جانوري الى جانوري السنه الجايه. هذا هو الابريزل تايم. شو حضرت شنو اللي تعلمته بهذه السنه. السابق هذا كريدت مال سي في تقدر تحطه بكذا بس مو بالابريزل. بالابريزل there was always the opportunity to learn. مثلا اقول لك انا مثلا اكو شغلات ويبينار you can choose it. self learning شنو؟ انا قريت بيبر عجبتني و I reflect on it. This is a learning. This is a CPD point. We can arrange something about CPD. تفضل. Continuous professional development هذه they have many things to do. You can prove that you're learning. Let's say خلينا نعطيك example مثلا list of patient interesting case you have. You present a case here. Interesting case. This is a learning. You can put it as CPD. You present a case. You discuss the case. Any learning event. It's not necessarily a conference. If you don't have opportunity to attend a conference.
نحن بقينا ب 23 24 كان عندنا برنامج محاضرات بمشروع التدريس.
نعم.
وكان برنامج غريب جدا. نحن توقفنا بس من فتره قصيره طبعا ما بنعرف ليش بس يعني نحن من مؤسسين المشروع الدكتوره رولا. فعندنا كان كثير ايفنت بس ما بعرف نرجع نذكرها نحن بالتاريخ مثلا.
مو لا قلت لك الجديد الحادث اللي هذا الليرنينج سي بي دي مو انت تحتاجين مثلا احنا قلت لك 50 بوينت سي بي دي بوينت بالسنه 50 بوينت كان بي اني ثينج حتى تدريس مثلا ايفنت درستي مثلا طلاب او درستي زملاء او اعطيتي محاضره دي كان count this as a CPD. الCPD هاي continuous professional development اشياء نعملها احنا بس احيانا المشكله ما نسوي لها ريكورد. recording is important و reflection on those events. انا ممكن اعطي محاضره عن الCPD ممكن احضرها how to gain CPD point. هاي نقطه. To cover it ان شاء الله نحضر نرتبها ان شاء الله. انا اقترحت على الدكتور حيدر حتى جراند راوند نسوي جراند راوند. We should be weekly but at least we can start a monthly grand round و present your case sharing experience حتى انا اعرف مثلا what's happening in خديجة what's happening in مجتبى so we can learn from each other. We can improve that way.
Something is called continuous education.
اي CME. American call it CME.
You have to get every year.
CME هذه نعم. Same as CPD. Same thing. CME is American. CPD is UK. Dr. Mahdi will highlight
I have
something.
to get these points here in Iraq for us as
I will show.
Syria.
I will arrange a lecture on about CPD and CME. I'll show you how to gain 50 point a year, inshallah.
So actually, let me just support what Dr. Ammar is saying. Speaking of American and US, let me just say this as somebody who worked in the US, and I hope this is not recorded, but I think that the UK system of appraisal is better, and here's why. In US, the appraisals, there's a heavy emphasis on the outcomes being clinical competency. In UK, like Dr. Ammar was saying, they take a 360 view, meaning they have an equal balance on not just your clinical competency as an outcome, but also how the staff and the patients perceive you. And the reason that's important is because research after research shows that patient outcomes, at the end of the day, are more dependent on the holistic system that is driving it. Not if one physician is the best physician and their clinical competency is great. Because what happens after their surgery, as you know, the immediate post-op care is just as important. The pre-op care is just as important. The discharge process is just as important. And all that depends on how the team is 360-wise. Whether or not the compliance of the patient after discharge in keeping up with the medications. It depends on the physician being able to communicate effectively and convince the patient. So I think the UK system is better, so that's one thing. Number two, as far as the CME or the CPD points are concerned, we will, like Dr. Ammar was saying, we will help you arrange some of the lectures here. CME tends to be a little bit more strict, I think, in terms of how they have to have the requirements, but even that, we will be able to do it. It's no problem. Here's what's interesting. Like Dr. Ammar was saying, you can read journals and articles and get CME points even. Remember when I said CME is more strict? Well, guess what? Many journals now.
Yes, CME.
Yes.
Yeah. Like a New England Medical Journal.
Exactly. If you log in, if you have an account, they do the work for you. In fact, even up to date.
Yeah.
If you're up to date, they will give an estimate of, they think, how long will it take for you to read this guideline? And they'll give you a CME point for that. So CME.
Medscape also may give us
Exactly,
CME, yes.
exactly. So you can earn CME points, and then we can arrange virtual conferences from international colleagues. You have a brilliant colleague over here. I say this, even if he was not here, we are really lucky to have Dr. Ammar here. You can earn CME points from him. If you put his resume anywhere in the world,
Yes.
that would qualify. So we can help arrange that. But I think the main point he was driving at is this. Let's start the story from backwards. You want to have a hospital that is functioning at a very high level. How do you do that? You make sure your physicians and the other clinical providers are properly licensed to practice. They have, in Britain, for example, they call that validation. In US, they call that privileges, meaning you are privileged to practice this skill, this procedure in this hospital. Your skills and competency is validated. But let's talk about what happens before that. Before that, the foundation is whether or not you yourself are willing to improve yourself. And that's what he was the point he was trying to make, is that we can talk about job duties and competencies and all this, but we cannot do is help develop a culture without your help. So that culture needs to be, how can I improve myself? And this is an opportunity. The beauty of this is that it's not more work, it's actually an opportunity for you to talk to your senior, for you to talk to somebody who has more contacts in the hospital. I'm more interested in the future being in executive management. Okay, now they can help you. I'm more interested in publishing a paper in JAMA or New England Journal. Okay, now they can help you. So this is really an opportunity. Once you have that culture of self-improvement and really trying to improve yourself, then you can build on everything else. Clinical competency, the reviews, and then the hospital can get to a system that is working at the highest level.
دكتور معلش برجع اسال سؤال بنفس الدومين يعني مثلا السنه الماضيه كان عندنا حالات كثير غريبه بالنفرولوجي. دكتور عمار انا لقيت فيه مره واحده
نعم.
انا دورت على لينك لانشر انه انا طبيبه في مستشفى خديجه عندي حالات غريبه شوي مرت علي في عياده الكلى ما قدرت طلب مني اللينك
كيس ريبورت ايه
فنحن محتاجين بس تساعدونا بالانترنت يعني احنا كيف نطلع المقالات المصدرة او الاشياء اللي صارت معنا بهي العيادات للعالم يعني بالمونديال يعني باليوم العالمي للكلى انا حاولت انشر 5 حالات من الشذوذ الكلوي مرت علي خلال سنه في عياده الكلى في مستشفى خديجه المقال ما وصل بعثوا لي هن انه لازم المشفى يكون الى موقع عالمي او لينك عالمي نتواصل نحن عليه فما عرفت كيف بدي اتصرف راجعت انا الاي تي عنا قسم الهندسه تحت قالوا لي انه حيعملوا فينا بعد لينك يمكن حتى نقدر نحن نتواصل مع مثلا الجورنال اوف كيدني امريكان جورنال اوف كيدني نحن ما فينا نتواصل معهم
ليش؟
في لازم يكون في تواصل
لا نقدر
ما بيرسونال يعني مو انا كدكتوره منى لازم انا اللي معك
ممكن نعمل
فما فيني انا
نشر الحالة.
لا دكتوره مو يعني
I think what's important to remember is that when we do appraisals, it's not just the person who, the junior, it's not just them who are being held accountable. The beauty of this program is that even your seniors are being held accountable. So yani, Dr. Ammar, I mean, he is very senior. So he doesn't have a lot of more people senior to him when he is back home. So when the junior comes and he's seeking his advice to improve, the system makes sure that even Dr. Ammar is being held accountable to provide that support. Everything that you're talking about, once we start a system, it's not just you who will be held accountable. If you have those cases, even your seniors will be held accountable. Okay, she came to you for this ask, support, what did you do? Right, Dr. Ammar? Maybe you can add.
I think the question was about publishing.